Hello everybody, so good to be with you again. Today we want to answer a specific question. What happens if you have undergone knee surgery for a meniscus tear and the surgeon has sewed your meniscus back, but 5-6 months down the road, after returning to running, you don't feel that the gait is the same. You don't feel like you're running normally again. And that could be due to multiple factors. You see, the interesting thing is that when we consider the multiple factors, there is hope for full recovery. But if we give up and say, I've tried a dozen things, nothing has worked, and then you give it up, and 20, 30 years down the road, you have a beer belly because you haven't run for 20, 30 years. So here are some things to explore. First of all, to reduce the inflammation on the knee, apply Ventolin gel. So you want to apply Ventolin gel, as we mentioned, because this is a very strong anti-inflammatory non-steroidal drug, diclofenac sodium. So you can put some on your fingers and apply it on the areas of pain as well as the structures we delineated. We mentioned in the other videos on how to use Ventolin gel. We mentioned in 2 or 3 videos how to treat the anterior structures of the knee as well as posterior structures. Then apply the gel on all the surrounding structures that may be causing the pain because of tightness. So apply it on the IT band, apply it on the rectus femoris, vastus lateralis, vastus medialis. If it is on the anterior medial side of the knee, the meniscus horn, anterior medial meniscus horn, then apply to the adductors as well. And also even the IT band can cause pain on the medial knee. So you can watch those videos. If it's in the posterior knee, of course, apply on the hamstrings, the biceps femoris, the semitendinosus, semimembranosus, the popliteus. Very important. But then, now we got to talk about a very important topic. And this important topic is Michael Boyle's joint by joint approach that we have gone into detail on, what I call the alternating joint approach. So remember that the knee joint is supposed to be a stable joint. The ankle joint and the hip joint are supposed to be mobile joints. So if the ankle joint and the hip joint have somehow become fixed because of injury or tightness or sitting down for too long, fixed positions, fixed postures, somehow they become tight, okay? Because they are weak in the long positions. I won't even say you've lost the ability to stretch. You've lost flexibility in the hip joint and in the ankle joint. What will happen is that your knee joint may be forced to twist. So torsion in the knee joint is usually what causes meniscus tears. And we want to address that issue. So now that you've undergone meniscus surgery, it's been repaired, you've gone through 5-6 months of therapy, you still don't feel the same as whenever you've returned to running, make sure you mobilize your ankle joint and your hip joint. And we have a video on mobilization of the ankle joint. We also have a video on mobilization of the hip joint. So please watch those and perform those exercises. Secondarily, after you mobilize the ankle and the hip joint, you want to strengthen the structures around the knee that actually might have become weaker as a result of the meniscus tear and or the subsequent surgery to repair the meniscus. So here the recommendation is watch the video on how to perform a simple lunge and the differences between a simple lunge and a split squat. My recommendation is that you start performing controlled split squats, progress in several weeks to a controlled forward lunge, okay? And then progress to alternating lunges, because you see they're increasing in both range of motion as well as balance, yeah? Because when you move from a single leg lunge, simple lunge, to an alternating lunge, you're now increasing the challenge on your balance. So that increases the challenge on the muscles that balance or stabilize the knee. So that's why you want to do it one step at a time. Followed by these two types of exercises done together. One is the multi-directional lunge, and that is one of the first videos I recorded for this channel. Please watch that if you haven't. So perform the multi-directional lunge as the third step. So controlled split squat, controlled simple lunge, and then alternating lunges. So the fourth one is the multi-directional lunge. You can watch that video, it's on this channel. And a fifth exercise that I'm going to introduce today, which is the controlled acute lunge, acute angle lunge for the knee. And how do we do an acute level lunge? An acute angle lunge. Now remember, in the simple lunge, we talked about stepping forward so that far enough so that the knee does not go beyond the toes. That's very important, okay? So step forward large enough so that the knee, when you go down, does not go ahead of the toes, the planted leg in front. In the acute lunge, this is a controlled body weight acute lunge, okay? It's controlled. In other words, if you need to hang on to some parallel bars or a post or something, make sure you do that. But most of the body weight should be on your rear leg. What you want to do is you want to step out, not very far off, not very far ahead, and this time allow the knee to go beyond the toes a little bit. You want to control the descent and don't go down all the way. Avoid going down all the way. So you control the descent and you feel a little bit of pressure on the patella tendon and the quad tendon, and you come up. So this is more like a controlled acute split squat first, okay? You do a controlled split squat on that knee, okay? On that knee, controlled split squat. So in this case, you are putting the knee in an acute angle, unlike the normal full split squat and the full simple lunge, where you go all the way down as low as you can. In this case, you're not going down all the way. You're controlling and putting your body weight, most of your body weight on the supporting rear leg, but you're putting some body weight on the front leg, on the front knee, and going down a little bit at a time, putting your knee into an acute angle ahead of the toes, but it's very controlled. So you want to put in a little bit more weight, a little bit more weight, a little bit more weight. This is going to be the exercise that I recommend as you perform the multi-directional lunges, because multi-directional lunges are that step, after the simple lunge and the alternating lunge. You're gonna put the surrounding structures of your knee to the test and exercise them by going in multi-directions. So multi-directional lunge, ahead 45 degrees in each direction, lateral lunge 45 degrees to the rear, directly to the rear, and then same for the opposite side. And we mentioned variations of this, even to the point where you progress to doing them, performing them without a pre-planned sequence, and you want to move in various directions without being in a fixed sequence, because that actually increases the trigger for bone density growth. But then again, that was for bone density growth, and in this case we're talking mainly for the ability of the muscles surrounding the knee to stabilize the knee. So putting them at various angles would be good. But notice all this is done after the ankle mobilization and the hip mobilization. Because imagine if your ankle is stiff, and that was the original cause of the injury. Imagine if your hip is stiff, and that was the original cause of the injury. And now you perform a multi-directional lunge. What's going to happen? Instead of your ankle and your hip allowing for the mobility to move in those directions, your knee will be forced, instead of being stabilized itself by the surrounding muscles, it is now forced to mobilize, because otherwise you can't move in those directions. Right? So imagine in the early days of a robot, for example, uh, if you had fixed joints and everything was a hinge joint, that leg's not going to move out, right? You're going to feel a lot of torsion on the knee joint. Of course, if you create a robot that has a mobile hip and a mobile ankle, then that would easily be possible. But then, of course, balance and all that coordination is another story in robotics. Um, so you get what I mean. You need mobility in the ankle and the hip before you perform these knee strengthening exercises. Otherwise, your knee will be forced to mobilize and you recreate the meniscus tear. And that's the last thing we want. So I hope this benefited you in some way, and I'll see you soon again. Thank you.